Hi, welcome back to another episode of Doctor's Discoveries. Today we'll be talking about anhidrosis. I'm Sharvi.
I'm Serena.
I'm Shanti.
And I'm Ellen. Anhidrosis is basically a very rare condition in which the sweat glands make little or no sweat. This is a very rare condition that can affect the whole body or even just very small parts of the body. And there are also many causes, such as severe burns, radiation, infections, inflammation, other injuries to the skin, certain medicines, dehydration, or conditions that affect the skin again. And some people wonder if this is an inherited disease or inherited condition or is developed later in life, but the truth is it could be both. Some genetic and inherited conditions would be the Ross syndrome, which is a neurological disorder that causes patchy sweating, and hypohidrotic ectodermal dysplasia, while, again, anhidrosis can be acquired in your lifetime by things like skin damage and nerve damage. Having anhidrosis is very dangerous as your sweat glands are basically not functioning as they should to remove heat and cool the body down. And some symptoms of it would be little or no sweating, dizziness, muscle cramps, fatigue, overall weakness, and not being able to cool off. A big pattern of anhidrosis is when there can be heavy sweating in other body parts while there is a lack in other places. This is because your body is attempting to make up for the lack of sweat in the areas that are not producing enough sweat, which is not usually a problem because it is still cooling down the parts of your body nevertheless. But then some other people or others wonder if anhidrosis can cause extreme damage, and there are very severe cases that could result from anhidrosis, such as heat exhaustion, which is when you feel extreme weakness or nausea, rapid heartbeats after participating in exhausting activities, especially in hot weather. Another severe case from anhidrosis would be heat stroke, which is a very life-threatening condition where your body temperature can rise up to 103 degrees Fahrenheit or even higher. And some results of the heat stroke would be confusion, loss of consciousness, and even a coma and even death. But there are also many outlooks after getting diagnosed with anhidrosis. Anhidrosis is a lifelong condition, but there is still treatment that is apparent, which can improve your anhidrosis, but of course not heal it permanently. In other cases, when the anhidrosis is caused by certain medicines, the anhidrosis is usually reversible after stopping the medicine. Shanti, Sharvi, would you like to add on to this?
Yeah, sure. So anhidrosis can come from a lot of different causes, but there are a couple, like the main three. So one of them is sweat gland dysfunction, and this is if the glands themselves are damaged. So some possible causes of this can be a skin injury, burns, or genetic disorders which affect sweat gland development. So the mechanism of how this works is there's some abnormal development in ectoderm-derived structures, and that causes reduced or absent like sweat glands, so no sweat production is possible. Another cause is nerve damage, where basically sweating depends on autonomic nerves, and damage to the sympathetic cholinergic pathways prevents signal transmission. So the way this works is that there's nerve degeneration, which reduces the sweat release, and then sweat glands, it reduces this chemicals release, so sweat glands never receive the activation signal. Then another cause is blocked sweat ducts. So sweat glands produce sweat, but ducts become obstructed, and keratin or inflammation is usually why the ducts are blocked, and sweat accumulates beneath the skin, so the sweat cannot reach the surface. Shanti, do you want to talk about some more causes?
Yeah, so there's also other causes adding on to Sharvi, but one of the more common ones is caused by when the patient has diabetes. And how this works is when they have chronically high blood sugar, it damages the tiny blood vessels that supply nerves with oxygen, which then in turn damages the nerves. And then those nerves that are damaged swell, and they can't they don't have the ability to transmit signals anymore. And then obviously your body can't sweat, and that's called peripheral neuropathy, which is common in diabetic patients because of this, and it basically causes anhidrosis. And then another way is by like being exposed to a lot of alcohol, because basically alcohol acts as a neurotoxin, and when you when you have prolonged exposure to it, it damages peripheral nerves, which are like the main nerves that dictate perspiration, which is like sweating. And like more specifically, chronic alcohol intake often causes vitamin B1 deficiency, which is important for nerve health and function. And then when those nerves are damaged, they are not able to reach the signal from the like part of your brain to release sweat, and that basically causes anhidrosis. And studies have shown that long-term alcohol abuse is strongly linked to anhidrosis and a lot of other things too, so it's like not good for you, not just because of that, but yeah.
So some details in like a more cellular level is that sweat gland cells, so basically there's this thing called eccrine glands, which contain secretory epithelial cells that transport ions. And then the key processes that they're like in charge of is sodium and chloride ions transported through the channels, and then water follows through osmosis, and then that's what causes sweat to form and move through your ducts. So important ion channels include the CFTR chloride channel and then sodium transporters. But defects in these ion transports disrupt sweat production, which can also cause anhidrosis.
Yes, so some like treatments or management of anhidrosis is like if you want to get a treatment for your anhidrosis, it depends a lot on like why you have it, like the underlying cause. So if the condition results from medications, side effects, doctors would probably just recommend adjusting the dosage or switching to a different medication. And when the cause is like a disease like diabetes or nerve damage or something like that, then treating the primary condition will usually restore the normal sweating. For people with localized anhidrosis, which is just like anhidrosis in one region, doctors may focus on treating the skin condition affecting the sweat glands, and this can include therapies for blocked sweat ducts, topical treatments for skin diseases, or managing inflammation that interferes with normal sweat production. When sweating cannot be restored, management focuses on preventing overheating, because individuals may need to stay air conditioned. They need to drink a lot of water and wear loose clothing, and they also should just like avoid strenuous exercise, especially when it's like hot outside, and they should take cool showers or use cooling towels to help regulate body temperature. And in certain cases, doctors may prescribe medications or something like pilocarpine or a similar drug that can stimulate the sweat glands, but these medications only work in some patients and can like depend on whether the sweat glands themselves are still functional at all. So for some fun facts about anhidrosis is that, or like sweating in general, is that sweating is one of the body's most powerful cooling systems, and the evaporation of sweat can remove large amounts of heat. In people with anhidrosis, the body must rely on less efficient cooling methods like increased blood flow to the skin and faster breathing, which is why they may overheat more easily. And then some people with partial anhidrosis experience this thing called compensatory sweating, and this means that parts of the body can still sweat can produce extra sweat to compensate for areas that cannot sweat, which kind of leads to like uneven sweating patterns. And then another fun fact is that the human body contains around 2 to 4 million sweat glands, but someone with anhidrosis may have many glands that simply don't respond to nerve signals rather than being completely absent. Anhidrosis sometimes becomes noticeable during exercise or hot weather when most people sweat heavily, but someone with the condition remains unusually dry when they're feeling overheated or like flushed, which is kind of weird. And then lastly, because the condition affects temperature regulation, people with anhidrosis often have to be especially careful during heat waves or intense workouts, because in severe cases, like when you're overheated and untreated, it can lead to heat stroke and people can die. So I guess it's just really important to be careful. So I think that wraps up today's episode. I'm Serena.
I'm Sharvi.
I'm Ellen.
And I'm Shanti. Just a quick disclaimer, this podcast was researched and created by high school students, so not everything will be 100% true. Thank you for listening.